अस्सलाम वालेकुम नाजरीन, मैं हूं आपकी ब्यूरो चीफ अंजुम अनवर डालस से आपको खुशामदीद कहती हूं और सफ़ीर पाकिस्तान के इस प्रोग्राम में हम आपको आज वेलकम करते हैं। हमारे साथ इस वक्त डॉक्टर दाऊद नासिर हैं जो कि अपना नॉर्थ टेक्सास चैप्टर के प्रेसिडेंट भी हैं। और नाजरीन, आज हम उनको इंटरव्यू करेंगे, आपसे इनकी बातचीत कराएंगे और इनसे कुछ सवालात पूछेंगे जो कि आपको अच्छे लगेंगे, अच्छी इन्फॉर्मेशन होगी। तो आइए बातचीत करते हैं डॉक्टर दाऊद नासिर से। डॉक्टर साहब, वेलकम ऑन द एयर।
अस्सलाम वालेकुम, थैंक यू वेरी मच फॉर ब्रिंगिंग मी ऑन द शो। आपका बहुत शुक्रिया और सफ़ीर पाकिस्तान का बहुत शुक्रिया कि आपने मुझे ये टाइम दिया।
बिल्कुल डॉक्टर साहब, आप ये बताइए कि सफ़ीर पाकिस्तान आप देखते हैं?
बिल्कुल बाकायदगी से देखता हूँ और अगर कभी बिज़ी हूँ ना देख सकूँ तो मैं रिकॉर्ड कर लेता हूँ। हमारे पास DVR है, आई थिंक इट इज़ वन ऑफ आवर फेवरेट शोज़, क्योंकि वो पाकिस्तान के बारे में बताते हैं और जो लोग यहाँ पर आबाद हैं और उसमें बताते हैं कि उन्होंने अपनी ज़िंदगी का जो है में कैसे कैसे जद्दोजहद की और कैसे कामयाब हुए, और फिर हमारे मुल्क भी याद दिलाता है। तो आई थिंक इट्स वन ऑफ आवर फेवरेट प्रोग्राम्स।
थैंक यू सो मच। तो डॉक्टर साहब, आइए आज हम आपसे कुछ सवालात पूछते हैं और आप जो अपने प्रोफेशन के बारे में भी कुछ बताएंगे। ऑब्वियसली आप डॉक्टर हैं और डॉक्टर्स की काफ़ी स्पेशलिटीज़ होती हैं, डिफरेंट किस्म के डॉक्टर्स होते हैं। तो व्हाट इज़ योर स्पेशलिटी?
मेरा नाम डॉक्टर दाऊद नासिर है। मैं एसोसिएट प्रोफेसर हूँ एट यूनिवर्सिटी ऑफ टेक्सास साउथ वेस्टर्न मेडिकल सेंटर। I'm basically an anesthesiologist or pain specialist. I'm also the director of acute pain and regional anesthesia in Parkland Hospital, which is an affiliated hospital for UT Southwestern Medical Center. और मेरा काम है कि मैं लोगों को वहाँ पे पढ़ाता भी हूँ और I started this acute pain service over there and it has flourished under my guidance. और उसका जो है जो कुरिकुलम है, जो हैंडबुक जो वहाँ पे कुरिकुलम में पढ़ाई जाती है, आई एम द सोल ऑथर फॉर दैट, और वो मैंने लिखी है वहाँ पर, एंड आई एम देयर फॉर लास्ट 8 years एज अ डायरेक्टर। और उसके अलावा मैं काफ़ी वर्कशॉप्स भी करता हूँ जो कि एनेस्थीसियोलॉजिस्ट को, इस इलाके के तमाम एनेस्थीसियोलॉजिस्ट को जो है बहुत हेल्पफुल है। इसके अलावा मैं जो है बोर्ड एग्जामिनर का रिव्यू कोर्स करवाता हूँ, रिटन के भी और ओरल के भी। तो ये जो है मेरी जो है आई वर्क इन दैट कैपेसिटी। उसके अलावा मैं जो है सिर्फ पढ़ाई के अलावा भी जो है लोगों को पढ़ाने में और उनको गाइडेंस देने के अलावा भी मैं डैलस काउंटी एनेस्थीसिया सोसाइटी का मैं प्रेसिडेंट रह चुका हूँ 2 साल पहले। आई एम द एक्स प्रेसिडेंट। और इसके अलावा मैं अपना में भी काफ़ी इन्वॉल्व हूँ एंड आई एम द प्रेसिडेंट ऑफ नॉर्थ टेक्सास चैप्टर, जो कि काफ़ी बड़ा चैप्टर है अपना में। और इसमें यह कि मैं इससे पहले जो है अपने कायद मेडिकल कॉलेज का प्रेसिडेंट भी रह चुका हूँ। आई एम द एक्स प्रेसिडेंट ऑफ कायद मेडिकल कॉलेज, और उसमें हम अपने मुल्क के लिए भी काफ़ी चीज़ें करते हैं। जैसे हम 50-50 स्कॉलरशिप देते हैं हमारे अलमनाई उस कॉलेज को, उन स्टूडेंट्स को हु कैन नॉट अफोर्ड। तो इस वजह से ड्यू टू माई कंट्रीब्यूशंस टू द कॉलेज ऑलवेज गिव्स अ गोल्ड मेडल इन माई नेम। द बेस्ट ग्रेजुएट गोल्ड मेडल इज़ नेम्ड एज डॉक्टर दाऊद नासिर गोल्ड मेडल फॉर बेस्ट ग्रेजुएट, और वो अवार्ड करते हैं हर साल उस कॉलेज में।
दैट इज़ गुड टू नो, दैट इज़ वेरी गुड टू नो, माशाल्लाह। तो आप बताइए कि आपकी वाइफ भी माशाल्लाह से डॉक्टर हैं। व्हाट इज़ हर स्पेशलिटी? आई विश शी वाज हियर टुडे, बट
हाँ, वो काम पे गई हैं। वो जो हैं, माई वाइफ इज़ अ लॉ ग्रेजुएट। पाकिस्तान से भी उनका ताल्लुक भी है, कराची से है। बेसिकली मेरा ताल्लुक पंजाब से है, उनका कराची से है, और वो साइकेट्रिस्ट हैं। एंड हमारी एक बेटी है, शी इज़ 17 years old एंड शी गोज़ टू हाई स्कूल एंड शी विल बी गोइंग टू कॉलेज इंशाल्लाह ताला नेक्स्ट ईयर। तो इसलिए ये जो है कि इसलिए हम सर्विस जो है अपना में कर सकते हैं कि अपने में उन लोगों को ही आगे आना चाहिए हु कैन गिव टाइम, क्योंकि अमेरिका में जो है टाइम वक्त की कमी होती है। टाइम इज़ मनी, एंड आई थिंक तो हमारी घर की रिस्पॉन्सिबिलिटी जब पूरी हो गई, हमारी कॉलेज बेटी जब कॉलेज चली जाएगी, दैट्स वाई आई एम प्लानिंग टू कॉन्टेस्ट फॉर ट्रेजरर फॉर 2015। क्योंकि इसलिए कि देखें कि आई एम प्रोफेशनली वेल सेटल्ड एंड घर में भी है मेरी जो रिस्पॉन्सिबिलिटीज़ हैं विल बी कम्प्लीटेड वंस माई डॉटर गोज़ टू कॉलेज। सो आई हैव प्लेंटी ऑफ टाइम टू सर्व द ऑर्गेनाइजेशन विच आई लव। तो इसलिए मैं कहता हूँ कि भाई कि इट हैज़ टू बी वो वही लोग हों जिनके पास टाइम भी है, बिकॉज वी हैव इट नीड्स लॉट ऑफ टाइम with effort also, with energy also, and with also experience, because मैं पहले डैलस काउंटी एनेस्थीसिया का प्रेसिडेंट रह चुका हूँ और डेलीगेट मेंबर हूँ टेक्सास सोसाइटी ऑफ एनेस्थीसिया का, डायरेक्टर रह चुका हूँ फॉर लास्ट 8 years। सो आई हैव लॉट ऑफ एक्सपीरियंस, और अपना में भी काम कर चुका हूँ। अपने आई वाज co-chair in spring meeting which happened in Dallas. I was also involved in several different committees अपना जैसे विंटर मीटिंग मैंने पाकिस्तान में एक कराई है या डैलस में जब समर मीटिंग हुई थी आई वाज वेरी एक्टिवली इन्वॉल्व इन ऑल द कमिटीज़ इसके अलावा भी जो है फॉर लास्ट 15-16 years आई एम द लाइफ मेंबर ऑफ अपना और also lifetime member of my own alumni also. So I'm involved in Apna affairs and Apna committees for a very long time. No, not me, my wife is also involved. She was a chairman of the CME committee for summer meeting when it happened in Dallas. So we have been involved in this organization for a long time and now I want to serve it in a different capacity.
तो ये डॉक्टर साहब ने अपने बारे में कुछ बताया अपने प्रोफेशन के बारे में और अपना की एफिलिएशन के बारे में एंड ही हैज़ डन अ ग्रेट जॉब इन अपना एंड आल्सो अदरवाइज इन हिज प्रोफेशन जैसे कि इन्होंने बोला कि गोल्ड मेडल इनके नाम से दिया जाता है हर साल फ्रॉम हिज यूनिवर्सिटी सो दैट्स अ ग्रेट कॉम्प्लीमेंट डॉक्टर साहब आई रियली congratulate you on that and it's a hard job but the people who have passion for that they love it and they do it and they get a great achievement out of it am I right Dr. Saab?
बिल्कुल बजा फरमाया आपने क्योंकि असल में हमारे ख़मीर में जो है हमारी मिट्टी में पाकिस्तान की मोहब्बत और उसकी लगन जो है मौजूद है वो कभी नहीं निकल सकती इसलिए यह है कि अगरचे कि हमारा जिस्म यहाँ पर है हमारा दिल पाकिस्तान में है तो वी ऑल्सो ओ टू दिस कंट्री ऑल्सो कि इसमें इस मुल्क के जो अच्छाइयाँ हैं वो भी हम उसको उन्हें भी अडाप्ट करना चाहिए जो पाकिस्तानी और हमारी कल्चर में भी अच्छी चीज़ें हैं और इनका जो है मिलाप हो जाए तो इट इज़ अ बून फॉर अस स्पेशली फॉर आवर किड्स हु ग्रू अप ओवर हेयर कि ये नहीं कि ये इस मुल्क में भी अच्छाइयाँ हैं हमारे मुल्क में भी अच्छाइयाँ हैं तो हम दोनों अच्छाइयों को लेकर चलें साथ सो आई थिंक दैट शुड बी आवर गोल एंड दैट शुड बी आवर कमिटमेंट तो इसलिए मैं चाहता हूँ कि अपना जो है although it's an organization but it's an American organization we have to understand that ये पाकिस्तानी organization नहीं है although Pakistanis are a part of it but we live in America we live in this country we have to follow the rules और उसमें यह है कि इसलिए मैं कहता हूँ कि अपना की जो है कि जो बुलंदी है वो we have not achieved that उसका जो है कि to accomplish great things we must not only act but also dream not only plan but also believe तो ये है कि मैं कहता हूँ कि ये this should be we should dream high for Apna and I think Apna is capable of achieving all those.
Well, thank you, Dr. Saab. I appreciate it. And tell me a little bit about your experience and working with Dr. Nasir. I understand you work with Dr. Nasir here.
Yes, I do work with Dr. Nasir. I've known him since residency, which is the training we do as doctors before we go out on our own. And he was one of my mentors and teachers, and he is a great physician, a great clinician. He's got great technical skills, and he's taught me a lot. And then as a colleague, I've worked with him for several years, and he is a good mentor to bounce ideas off of. He's always got great thoughts and ideas on patient care, and he's still teaching me many things as a colleague.
And now we have Dr. Michael Babiak with us today here at Parkland Hospital. Welcome on Safira Pakistan, Dr. Babiak.
Thank you so much.
Would you tell us a little bit about yourself, what you do here at Parkland Hospital?
Certainly. I've been a member of the Department of Anesthesia and Pain Management at UT Southwestern since 2005.
So tell me, Dr. Babiak, your experience and work experience with Dr. Nasir. I understand you work with him, and tell us a little bit about him.
Well, I met Dr. Nasir in 2005 when he joined the department shortly after I did. And I quickly came to realize that he was a very beneficial new addition to our department. He's accomplished many things in his 8-year tenure here. Perhaps one of the most significant is the development of our acute pain service, which prior to his arrival was a small service which served a small number of patients. It has now become a nationally recognized program under Dr. Nasir's leadership.
Aye Nazreen, now we talk to Dr. Drummond. She is here with us, and she also works at Parkland Hospital. Welcome on Safira Pakistan, Dr. Drummond.
Thank you very much. How are you today?
I'm doing really well. How about you?
Doing very well.
So tell us a little bit about your experience here at Parkland Hospital, what you do, what's your specialty, and how are you affiliated with this hospital?
So, I'm an anesthesiologist here, and I'm also an interventional pain physician, and I'm board certified in both anesthesia and pain management.
And I understand you work with Dr. Nasir as well. Would you describe your work experience, how you are affiliated with him, and at what capacity do you work with Dr. Nasir?
Sure. I work with Dr. Nasir in the operating room and as well as on the acute pain service. He is always someone that I can rely on for any type of help with regard to questions, someone to bounce ideas off of. He's always very professional. He's always very even keel and just a great resource, particularly for the younger faculty, and we really appreciate that.
Well, thank you very much for the kind words, and I am positive and I'm 100% sure that he does deserve all those kind words that you just said. How long have you been working with Dr. Nasir?
For a little over a year now.
Do you know that he is a member of, in fact, he's a president of UPNA North Texas chapter? So you want to give a message to other doctors?
I would encourage all APNA members to vote for Dr. Nasir because he is truly a professional.
And ladies and gentlemen, now we talk to Dr. Dushan. He's here. He is also a physician here at Parkland Medical Hospital. Welcome on Safire, Pakistan, Dr. Dushan.
Thank you very much for having me. I appreciate being here.
We appreciate your time. And tell us a little bit about yourself, Dr. Dushan, what you do here at Parkland Hospital.
Well, I'm an associate professor in anesthesia at Parkland Hospital. My working place is Parkland Hospital, but we're attached to the University of Texas Southwestern Medical Center. We have one of the largest residency training programs and one of the largest academic institutions in medicine. We're located in Dallas, Texas, and I'm very, very fortunate to be working here.
Now we have Amanda with us today. She also works at Parkland Hospital. Welcome on Safire, Pakistan, Amanda.
Thank you for having me.
You are welcome. Tell us a little bit about yourself, Amanda.
Well, I'm a RN, baccalaureate through OU Medical Center, and I'm an oncology nurse, actually up in Norman Regional.
So tell us a little bit about your experience, your work experience with Dr. Nasir, and what kind of a person he is, and as a doctor, as a human being, as an associate, as a colleague, whatever you want, as a boss. Tell us a little bit about him.
Well, he was certainly very encouraging in having me pursue a career in healthcare, and very friendly and very open, and certainly passionate about his anesthesia program and trying to provide pain relief to everybody, the population, and bring good quality health care to many.
Well, thank you so much. And tell us a little bit about Dr. Dawood Nasir. I understand you work with him. Tell us what your experience is and how do you perceive Dr. Nasir?
Well, I spent the last 8 years here at Parkland Hospital, and Dr. Nasir is one of our practice partners. And after a few years, he noticed that I was looking for a little bit more to do, and he invited me to help him out with the Dallas County Medical Society. And Dr. Nasir was the vice president and secretary for his first year, and then he became the president, and I was elected the vice president and secretary after that and got to follow in his footsteps. And working with him was indeed a pleasure. It was easy to do. Dr. Nasir was very conscientious. He made sure that everything was taken care of when he was president, and he left me a big vacancy to fill because his shoes were very, very hard to fill because he had done such an excellent job. Kept me on my toes for the next year.
So tell us a little bit about your work experience with Dr. Nasir.
Oh, Dr. Dawood Nasir. I've worked with Dr. Nasir for 7 years in many areas of the hospital. He's a great physician. He's a great individual, great clinician, really cares about the hospital, about UT Southwestern and all of its interests, and also is a great physician in terms of bedside manner.
Ladies and gentlemen, now we talk to Irina Gasanova. She's here at Parkland Hospital, and she would like to talk to us about tell us a little bit about yourself, Ms. Gasanova.
Hi, I'm Marina Gasanova. I'm associate professor and faculty at UT Southwestern Medical School, and I work at Parkland. I'm director of perioperative services covering OR, day surgery unit, preoperative clinic, and PACU.
And tell us a little bit about Dr. Nasir, your experience, your working experience, and your interaction as an individual.
Well, first time when I came here 7 years ago, he was one of the faculty who really greeted me, and I joined to his service when he is the acute pain service director, and I was one of the faculty who worked with him. So I think. In my understanding, every physician should be exactly like Dr. Nasir because he has a great skills. He is a great human person because he can understand what patient needs, what colleagues needs, and I'm really happy I have a colleagues like him.
Welcome on Safira Pakistan. Joe, how are you doing today?
I'm quite well, thank you.
It is so nice to have you on Safira Pakistan. Tell us a little bit about yourself, please, today, your experience at Parkland Hospital, and what do you do here?
Okay. I'm a nurse practitioner with the acute pain service. I help Dr. Nasir. He's my medical director with the pain service. So we diagnose and treat patients who have pain problems. We also help in their perioperative experience.
Okay, so how long have you worked here?
I've worked at Parkland for 14 years. I've been a nurse for over 30 years.
Wow, quite a long experience in nursing. So how do you find this profession?
I love nursing, and I love working to help patients, especially those who have pain situations or who may be going through surgery and need special healing time.
So tell me a little bit about Dr. Nasir. I understand you work with him and you have worked with him sometimes. So tell him what your experience with him.
Okay. Dr. Nasir and I go back to 2005 when he first came to UT Southwestern. It was my honor to have him as my medical director. And through his service and dedication, the pain service has expanded in the number of patients that we treat, in the number of residents that we teach about regional anesthesia, and also it has spread among the anesthesiologists and the surgeons as a very valuable service to provide those patients in the post-op pain experience.
So what kind of a supervisor he was? What was your experience with him?
Oh, he's excellent. We started out at three. We were three faculties, and then it came to a point that both of us it was just the two of us. And even though there were the two of us, we handled St. Paul, Zale, and Parkland quite well, I'd say.